Aurora pairs police officers with mental health clinicians when responding to 911 calls.
And this program cannot recruit enough mental health employees. Denver 7's Micah Smith explains how the city is now addressing this issue.
He keeps trying to kill himself.
Not many mental health professionals go to graduate school to wear bulletproof vests.
But Courtney Tassin, Aurora's crisis intervention program manager, says that's exactly what's required for clinicians on the city's crisis response team.
It's definitely not the traditional kind of counselor or social work role.
The program pairs police and clinicians for mental health 911 calls.
What they just aired was something that CRT would go on. Currently, I'm serving as a clinician on our team as well as being a program manager. As far as contracted clinicians at the moment, we do not have any.
Tassin says that's because it's tough to recruit.
I think mental health in general is a field that is struggling with staffing. I do sit on a board for all of the program managers across the state who are funded by the Behavioral Health Administration. There are over 1,000 vacancies across the state of Colorado.
A few days ago, Aurora police shot and killed a man they say was threatening RTD bus riders with a knife. APD said the man was a part of a mental health work release program.
The deputy called for police assistance.
But some city leaders wanted to know why a mental health clinician wasn't called.
So it's really hard to say if in that exact moment a crisis response team unit would have been dispatched. I wasn't there to hear the call notes or hear the air on the radio, but what I will say is our programs are best utilized when the primary concern for a call for service is mental health.
Tassin says with so many mental health calls coming in, the need is growing, and with that, the need for funding.
Currently, we are grant funded for our crisis response team. We're very thankful and lucky to have received the grants that we have, but the city is looking at funding this program and creating a more sustainable source of funding.
In the meantime, until more clinicians come on board, Tassin says her team will do all they can to de-escalate situations and save lives. Reporting in Aurora, Micah Smith, Denver 7.
Now let's dig a little bit more into why it is so hard to find mental health clinicians to fill these positions. Well, for one, the professionals in these positions aren't taught to be ready to put on a bulletproof vest to respond to scenes. And today we spoke with the program manager of the co-responder program at WellPower. WellPower helps provide mental health professionals for Denver's STAR program. Samantha Robbins says there's not much downtime in this kind of work.
Now we're asking staff to be in crisis at all times. And so it's definitely a specialized population of clinicians that want to do this work and want to be in the field all day. And so we really try as a team to say, how can we support you with being in crisis all the time? How can we support you with being in the field for your entire, your entire work hours, right?
And she says her team is constantly educating incoming social workers about positions in these programs to determine if this is a path they want to go down.